Hello.
Hi.
How you doing? Nice to see you. How are you? Hi, sweetie. How are you? So I really am actually...
A child's annual physical gives those in the healthcare community a chance to have an enormous impact on young patients when it comes to influencing their attitudes about drug and alcohol use. But it's not always easy starting a conversation about drinking and drugs with young patients. Some healthcare providers are worried about time and don't feel they have adequate training on the issue. And some worry they don't have sufficient resources for patients' parents if there is a substance use issue. Dr. Arturo Gonzalez, president of the Arizona chapter of the American Academy of Pediatrics, and Dr. Kathy Graziano, pediatric surgeon, share how they have overcome some of the most common barriers that have prevented providers from including substance use prevention information in primary care visits and why it's important to make a change.
The parents elected us to be their providers, and I'm taking care of them for simple things like ear infections or throat infections or pneumonias or fractures here and there, so they trust us. We gain a trust with them.
When a kid or a family member hears about substance abuse from a medical professional, I think that we have a certain sense of authority, and that helps.
I can ask any 9, 10, 11-year-old, and they know of someone who has smoked cigarettes, have drank alcohol, and done some drugs already. They've done it at that age. So that's where you bring it up.
I have lots of opportunities to talk to my patients about drinking and drug use, mostly drug use, and it's because I'm a pediatric surgeon. So when I'm in the office before an operation, I've got a 12-year-old, a 14-year-old, even a 7 or 8-year-old in my office who's about to have surgery. We do have to discuss their pain control after surgery, and I can talk about what kind of medications that they would be on. And I every time turn to the kid and say, but you would never want to take a medication that a doctor didn't prescribe just for you, right? That would be crazy.
I usually approach it in a non-threatening way this way. I said, are your parents worried that you may be smoking cigarettes or doing drugs or drinking alcohol? And they're very candid, you know, especially if you've known them for years.
For me, it's easy because the moments, these are teachable moments that happen around the time of surgery. But I think if you're in the office and there's any questions about prescribing medications, that's when it should come up. You want your practice to be healthy, all of your patients. And this is a good way to keep them safe and keep them healthy. And once you realize that, the conversations will come easily. They don't have to be long. If you talk too long, they start to tune out. It's 30 seconds to 60 seconds of information, and they listen. They're all eyes on you when you're having these conversations. They will remember that you had that conversation. You will have an effect on them. It can be delivered by a physician in a pediatrics office. It can be delivered by a family practice doctor. Nurse practitioners and PAs are amazing at talking about this type of thing with patients.
Or a healthcare provider if they have a health consultant in the office as well. The issue here is that it needs to be addressed. If you've never looked it up, go on a website, look what it's about, and there's phone numbers and people that you can talk to and say, how can I get involved?
I've been really impressed with DrugFreeAZ.org as far as their training and materials. They make it very easy for the physician to have some talking points and to understand what the real problems are.
The access and the information that I can get from them. There's a lot of great data, and we're updated often. All the information and the handouts that I have to give to my patients, the phone numbers from the family helpline that they have, it has been very, very helpful.
You can get online and spend a little bit of time on the DrugFreeAZKids.org, and you'll see exactly what's going on in the high schools. The partnership does research, and they are able to tell you, how many kids have tried a prescription drug and how many have tried marijuana or alcohol, and at what ages.
Take the next step and get involved with DrugFreeAZ.org. Email us at partner@DrugFreeAZ.org or call 602-264-5700 to schedule a training session for your office, to volunteer, or to sign up your office to receive our latest information, brochures, and materials for your patients' parents.